Welcome to a live OAC TV special event, Stop Weight Bias, hashtag be part of the solution. I'm James Zervios.
And I'm Kelly Murillo.
This is a landmark day for the OAC. This is the debut, the red carpet rollout of the Stop Weight Bias campaign, and we are super excited for everything in store today.
We truly are excited that you're here with us, James. It's such an important day. We have so many things in store for everyone here today.
And don't forget, we will have our normal broadcast next week, so stay tuned for details on that. You can check that more about that on Facebook. But today is a little bit different, because today we are celebrating the launch of Stop Weight Bias. This is, as we said, a landmark day for the OAC. This is the OAC standing up to weight bias, something that we know impacts so many people. I'd say almost everyone dealing with obesity. And it's like nothing we've ever done before. The reality is that enough is enough when it comes to weight bias. We're taking a stand today. We're releasing this amazing campaign, and we're finally saying it's time to stop weight bias.
Yeah, it's a very special day for us, and it's a project that we have been working on for so long, and we're so excited to share with you guys. And there's so many different components to this that we're going to be sharing today. So let's take a look at what's ahead today. So we're going to be unveiling the Stop Weight Bias campaign and a national PSA that we're so excited to share. We're going to take a deep dive into the latest research with some very special guests. So we're going to have Ted Kyle, who's an OAC member and founder of Conscient Health. We're also going to have Dr. Rebecca Pohl, Deputy Director for UConn Rudd Center for Food Policy and Obesity and Weight Bias Research. Additionally, we're going to have our OAC Chairwoman, Patty Neese, who will talk about her role in the Stop Weight Bias campaign and also her personal story with weight bias. And we're also going to teach you guys how you can be part of the solution to stop weight bias.
Yeah, the excitement of this campaign, Kelly, really speaks to the due diligence in crafting this campaign. This campaign has been more than 2 years in the making, and a ton of research has went into this. The OAC did focus groups, online surveys, in-person interviews, and so much of this information has even been presented already at international meetings worldwide. It was presented at Obesity Week this last fall. So we really took time to understand the issue of weight bias. And, you know, one of the things that I think surprised us the most, Kelly, in the beginning was that 90% of U.S. adults recognize weight bias exists. I mean, that is a tremendous number when you think about that.
It is a really big number. It's a strong number, and makes you wonder. But are we surprised as we, as the OAC, we hear these stories, we analyze this data, the research that we did for this campaign? There's so many things, but I think that it still takes us by surprise sometimes.
Yep.
And we want to hear, what you guys have to say as well. We're going to take a deep dive into this, and we're going to analyze different facts during this broadcast, and we want to hear your voice as well. We want to know what you guys think about this. Do you know what weight bias is? Have you experienced weight bias before? Tell us. Take a moment and go to the comment section on the Facebook Live and let us know what you guys think.
Yeah, and Kelly, we asked ahead of time in preparation for this special live event what some folks thought of weight bias or how have you been impacted weight bias. And we have a few different responses here. Peter says that he was looked over for a job opportunity because of his weight when he came for an in-person interview.
Sadly, not the first time that we hear that. We also have Jordan from California who says that going to the doctor makes her feel uneasy because her doctor always makes rude comments about her weight.
Well, and Kelly, that is one of those areas of weight bias that we hear so often, especially in the healthcare industry. And so unfortunate that we continue to hear that. Jerry from New Jersey says that he always sees people on his social media joking about others' weight and saying that they're lazy and that they eat too much.
We also have Michelle who says that she's always been teased by her family because of her weight, and she struggles with depression and self-esteem as well.
And I think all of these examples that we're seeing here today are just, they're classic examples of weight bias and ones that we've heard so often. And, weight bias is not always the easiest thing to understand. I mean, it's why that we've built this entire campaign around it. And we want to talk a little bit more about weight bias and what exactly is weight bias. And so with the campaign, we're defining weight bias as holding negative attitudes about someone's weight or harming and shaming them because of their weight. Now, we want to take a deep dive into this, or a deeper dive, I should say, And there's no better people that we could think to welcome and have this discussion than Ted Kyle, OAC National Board Member and founder of Conscient Health, and Dr. Rebecca Poole, the Deputy Director of Rudd Center for Food Policy and Obesity and Weight Bias Researcher. So Rebecca, Ted, welcome very much to the show. We know that you guys are on the front lines of this very important issue on a daily basis. I've had the privilege of working with you all now for 16 years, and all the work that you guys do to help further this cause of stopping weight bias. And we wanted to have the both of you on today to talk a little bit more and talk to the audience about what are some of the latest research we see in weight bias, and what are some of the things that you all see happening, maybe some of the shifts when it comes to this important topic.
Thank you so much for having us here to talk about that. There's really a lot going on, and I know we wanted to talk about some of the current research and any indications of whether this is getting better or worse.
Yeah, Ted, I think you bring up some really interesting points there with this issue. And when we think about this a little bit more, what do you think are some of the trends with weight bias that we're seeing right now? I know we talk about intrinsic bias being a little more prevalent than someone directly making some fun of someone with obesity, but how would you say that that's impacting people?
Well, why don't I start by saying that research continues to show that weight bias is very common in our society. It's been common for a long time. And we see from recent studies in the US that even though other forms of bias have improved over time, like bias related to race or sexual orientation, that implicit bias related to body weight really hasn't. And I think it's important to point out that weight bias is not really just a US phenomenon. This is a problem that is present in many different countries around the world, and it's a difficult bias to overcome. But having said that, we are seeing some examples of progress when it comes to addressing weight bias. There's certainly been an increase awareness about this issue in the past decade. And increasingly, we're seeing groups that are really calling out this problem and prioritizing efforts to address it. And a recent example is actually from this past year in 2020, when more than 100 medical and scientific organizations around the world signed a pledge to really recognize that weight bias is a significant problem causing significant harm, and it needs to be addressed. And it needs to be addressed in many different aspects of our society, including the healthcare setting. And so this is really the first time that the international medical community is speaking with one voice to condemn weight bias. And I think that's a really important step in taking action to address this problem.
Rebecca, what you say is so important. We have made some progress in terms of what we say and the commitment to fight weight bias. I think what OAC is doing is tremendously important, but there's a huge gap between what we say and what we do. That implicit bias, that bias that kicks in before we even think about it, just pops up all the time. An example not long ago was, Governor Cuomo, who, bless his heart, he's talking about COVID-19 and the interaction with obesity. And then he says, this wouldn't be a problem if people could just stop eating the cheesecake. Well, I'm sorry. New York style cheesecake is not the cause of obesity. It might be somebody's weakness, but that's not why we have an excess of obesity. It's been around for a long time. But that bias, that kind of automatic thinking that kicks in before we even stop to consider what we're saying is what creates this huge problem that you've done so much great research on.
Well, Ted, I think you bring up an important point, which is that this is a very automatic form of bias in our society. Sometimes we don't even realize when it's happening right in front of us. And I think that's one of the reasons why broader, bigger picture remedies are really needed to address this problem. And one of those areas is policy. And we are seeing some policy initiatives increase to try to address weight bias. And I think that's really important if we want to tackle this problem. And for people who might not know this, states like Massachusetts are trying to pass laws that would make it illegal to discriminate against people because of their weight. And certainly, there's a long way to go here in terms of changing policy. But we do see that there's a lot of public support in the US for laws that would make it illegal for employers to do things like engage in weight discrimination towards their employees. So I do think that we're moving the needle with this issue, even if change isn't happening quite as fast as we'd like it to.
I think that's a real good point. And when discrimination is not legal based on weight, then that gets people to think before they speak, and that can help us, I think, with that implicit bias. I've been reading a lot about internalized weight bias, and I know, Rebecca, you've done some fantastic research on that. Would you care to explain a little bit about what that is and why it's so important?
Sure. So internalizing bias happens when people are aware of the negative weight based stereotypes that really exist all around us in society. And when people start to agree with these stereotypes or apply them to themselves, it's really an internal process of blaming oneself for their weight or the stigma they experience. So, beyond actually experiencing stigma or unfair treatment because of a person's weight, internalization involves applying those experiences inward and really kind of engaging in self stigma. And we know that a lot of people who experience weight stigma internalize it. And that's really not surprising when we think about the negative societal attitudes around us and really the lack of efforts that challenge weight stigma. And when stigma doesn't get challenged, it becomes easier to internalize it. It becomes easier to blame ourselves. And one of the reasons why it's so important for us to understand this issue and to study it is that internalizing weight bias can really have negative implications for health, sometimes even more than the actual experience of stigma itself. And so, for a lot of reasons, we need to be paying attention not only to the societal weight stigma that people face, but also to the ways that people internalize it and blame themselves.
I get really frustrated, and it's honestly upsetting when I see people who have started to believe the lies that they've heard for their entire lives. What advice would you give people in who are listening to how they can support people and help them with this issue?
Well, I think the first way to be supportive is to really look inwards at our own assumptions and attitudes and biases that we may have and that we may unintentionally communicate. As you and I were talking about before, this is such an automatic form of bias that sometimes, even when we are well intentioned, we may be communicating blame or judgment or our own biased assumptions. So I think first we need to take a look at our own attitudes.
I think that's such good advice. I wonder, do a basic question. Um, how does weight bias have an effect on us? Why is it so important for us to pay attention to this?
It's a great question. So, the harms of weight bias are very real and they're long lasting. And weight bias is something that really impacts people's emotional well being, but it also impacts their physical health, their relationships with other people. It can affect the quality of their health care, their prospects for employment, their quality of life. So, it really can be harmful in multiple aspects of a person's life. With respect to emotional well being, for example, weight bias can lead to increased depression and anxiety, lower self esteem. With physical health, it can lead to higher levels of physiological, biological stress, but it can also lead people to avoid physical activity, oftentimes because that's where they feel vulnerable to experiencing stigma. And so they want to avoid that. Or it can lead to adverse eating behaviors like binge eating. And sometimes that happens because people may turn to food as a way to try to cope with the distress of experiencing stigma. And I think it's really important to highlight that weight stigma impacts health because it tells us that weight stigma is a public health issue. And we need to treat it as a legitimate public health issue. But again, this also affects the workplace. People experience unfair treatment because of their weight, and that can happen at the level of getting hired, but also in terms of things like promotion potential or job termination. In healthcare, we know that when patients have higher body weight, they are more likely to report being stigmatized by their healthcare providers. And this can lead to things like poor quality of care and poor communication between patients and providers. So, there are many ways in which it impacts us, and it can really take a harmful toll.
The other thing that I would add is that I think it really blocks progress. It blocks progress because biased ideas about obesity itself are used as an excuse to block access to care that could actually help people. And it leads to the adoption of policies, however well intended, that actually don't help. That suggest if you just urge people to make better choices for themselves, somehow obesity is going to go away. And we've been trying that for several decades, and that hasn't worked out too well. I guess one last question, which you would really know, Rebecca, as well as anybody. What are some of the new insights, the new research, the new data that we can expect to see coming our way in the future?
Yeah, that's a great question. We've recently completed some multinational studies looking at experiences of weight stigma in different countries and implications for things like health behaviors and emotional well-being. And I think it's so important for multiple countries to be working on this issue together because it really is a universal experience in many different places. So I do think we're going to see more kind of cross-national, cross-cultural research shedding light on this problem. But I think more than that, kind of in the moment right now, is given the pandemic, I really hope that we see more research on the role of weight stigma during this COVID crisis. The harms of weight stigma are very concerning in the context of COVID-19. So for people who have obesity, who are at higher risk potentially of complications, their health and well-being may be worsened because of weight stigma during the pandemic. So for example, we know under normal circumstances that people with higher weight may avoid or delay healthcare because of stigma. And if that's happening during the pandemic when people are experiencing COVID symptoms, or if they are afraid they're going to be stigmatized in healthcare, that could worsen their symptoms and their treatment and their care. And so there are a lot of reasons to be really paying attention to weight stigma during this time period. And we certainly need more research to really assess the impact that stigma may be having on people who are vulnerable to this virus and its complications.
Those are really good points. The other thing that I'd add is that I've seen some folks doing some research on ways to reduce the implicit stigma that's been such a challenge. And I'm really excited about the possibility that we'll come up with better strategies for dealing with that and evidence that it for what works and what doesn't.
Absolutely agree with you.
James, I just really want to thank you for the chance for us to chat about this. Where are you planning to go from here?
Yeah, and thank you both so much for talking about these topics. I think so many things I heard in there talk about, policy initiatives and state laws about it. These are all of the things that this campaign will really look to tackle in the future. And so I think, Kelly, you can speak a little more to how they address some of this stuff today. But I mean, this was just fascinating.
I mean, wow, first of all, right? Thank you, Ted and Rebecca, so much for being here with us today. I mean, I feel like you did an amazing job. Our viewers can tell us in the comments what they think about this explanation, but I think you really broke this complex topic down for us to something that we can all understand and kind of identify with as well. So we definitely look forward to working with you both as this campaign progresses.
Absolutely. Thank you both so much for your time today. And we'll definitely continue this fight with you guys.
Thanks, James. Good to see you.
Thank you, James.
So Kelly, I think as we were listening to Rebecca and Ted, we had comments coming in. We had one person ask us, can we address weight bias related to the Black and Hispanic populations? And the answer is yes. Actually, on the website, stopweightbias.com, there's a whole section on weight bias in ethnic and racial groups. And we actually have some fact sheets on that as well. So you can visit stopweightbias.com. You can learn a little bit more about that. And if you can't find the answer to your question there, please email us, and we're happy to help you a little bit further. And, Kelly, this is a different type of campaign for the OAC. And I think that, where this campaign came from at the end of the day was a very real place. And over time, throughout the OAC's existence, we've heard so many stories of weight bias and so many horrible examples. We've heard examples of people being referred to the zoo to be weighed. people not being hired for a job because of their weight. And when you look at that, that is really how we try to bring this alive and how we try to make this, something different. And it's like something we've never done before. It has a completely different look and feel.
Yes, James. I mean, not just like the different look and feel, but also like all of the different components that we put into this. We really want to make sure that you guys walk through the story of what weight bias is and what the Stop Weight Bias campaign is about. So we put a lot of time and effort into the different areas and components of this campaign, especially when it comes to marketing. There's so many things that we have at our disposal nowadays with like digital ads and then social media, which is so relevant nowadays. And something that's very unique to this campaign, it's the campaign PSA, which we're going to be discussing later today. But I think that it's something that's very different from stuff that we've done in the past.
It is, and this PSA is really about telling a story. So before we, crafted this PSA, we talked with OAC members, we talked to the general public, and we tried to figure out those instances of bias and where people experience it. And we put so much energy into the cast and the script to really show how bias impacts someone from childhood into adulthood. And we feel that that narrative was just so key to really hone in on that story.
Yes, and something that's very interesting and that we learned through the casting and the PSA and the weight bias stories and the research as well, is just because we know what weight bias is and just because we might have had an experience or know someone who has experienced it in the past, doesn't mean that it happens the same way. I feel like everyone has their own unique story when it comes to this.
Yeah, they really do. And we wanted to be able to feature one of these stories and talk a little bit more about how weight bias has impacted someone and the need for this campaign. And we couldn't think of anyone else to have on other than our brand new OAC chairwoman, Patty Neese. She actually just became chair less than 2 weeks ago. So Patty, are you with us? Welcome. Yes, we can.
Yes, we can. Hi, Patty.
Thank you for being a part of this very special day for OAC. And I think we'll just, we'll dig right in, right? So you've been a part of the creation of this campaign for the past 2 years. You've shared some amazing insights. But, now that the day is here, now that it's live, why do you feel a campaign like Stop Weight Bias is necessary?
Well, thank you for having me here. I'm pleased to be here on this important occasion. No matter what else is going on in the world, and let's face it, there's a lot going on, weight bias harms people. And it's never a bad time to launch a campaign to educate people about weight bias and the harms it does. I think that it is a continual daily problem for many people that live their lives at higher weights. And helping educate people and in understanding what weight bias is, it's so ubiquitous in our society that I don't think most of us really pick up on it. I certainly didn't until I started really, really thinking about it. So I think it's very important that we continue raising awareness of this issue and getting people to recognize that they can change small things that can make a big impact.
Patty, I think you hit a very key point there, and that's the awareness factor. At the end of the day, we know that people are not aware of weight bias, so they may not even be aware of being impacted by weight bias in some way. And so, again, that's such an important part of that campaign that we're launching.
It is a very important point, and I think another thing is, the awareness part of it, knowing that you're not alone through this process. So. Right. It's very important, and we want to know, what will you tell someone who has been impacted by weight bias?
The first thing I'd say is it's not your fault. It's not. The disease of obesity isn't your fault, but being impacted by weight bias isn't your fault either. I was interested in hearing Ted and Rebecca talk about internalized weight bias. Definitely what happened to me. I've had obesity since I was a young child, and I don't remember a time when I wasn't bullied and ridiculed over all these decades because of my weight. And I got to the point where I thought that was okay and that I deserved it. Well, you know what? I never deserved it. Not when I was a kid, not when I was a teen, not as an adult. Never deserved it. And it's not my fault that people are doing it to me. I don't want to claim to be a victim. I mean, in some respects, I made myself my own victim because I started believing everything they said. Despite every success in my life, career, relationships, etc., I thought I wasn't worthy simply because of my weight. And it's taken me a while to work on that, but I've gotten beyond that point. And I realized that that's just not the case. That's not the case. So I would want to tell people it's not their fault. They're not alone. And to really try not to take it on board personally.
Thank you, Patty. That was like a very powerful advice. And I think that just as a reminder for all of our viewers over there, like if you are experiencing weight bias or have experienced it in the past, remember, you're not alone and it's not your fault.
Yeah, Patty, you started to talk a little bit about how you've been impacted weight bias. And for those that are a part of OAC, you may have heard Patty talk at our past conventions and her story with weight bias. But Patty, maybe you can just talk to viewers a little bit for a moment and dive a little deeper into how you've personally dealt with bias.
Well, it started by finding an obesity care provider, an obesity medicine specialist that understood, that got that I had tried to do everything I could about my weight, but just wasn't successful. And that it wasn't my fault that I hadn't been successful. That was the beginning of lifting the curtain of weight bias for me. Here was a medical professional that actually accepted me and assumed the best of me, not the worst of me. The last thing he assumed was that I was a non-compliant patient or I was weak-willed, all of those things. In fact, he assumed the opposite of that. And that was where I started to begin addressing my internalized weight bias. Then I had to learn to listen to myself. I was saying very negative things to myself, and I'd been saying them for so long that I didn't hear them anymore. So I had to relearn how to listen to my thoughts about my own body and exercising some self-compassion when I heard those thoughts. Like if I was thinking you're a failure because you can't control your weight, I'd counter that with, is that really true? Am I really a failure? Well, of course not. I'm not a failure, especially not over this biological issue. So that helped a lot and moved me forward to the point where I've become much better at accepting myself and not blaming myself and not being mean to myself. It makes a big difference.
Thank you, Patty, for that. We're so lucky to have you at the OAC, and you have been with us for a while now, and I know that times change. Do you think that since your time with the OAC, have you experienced or have you seen any change in weight bias?
I think there have been slow changes. Rebecca mentioned that there are incremental changes. They're not happening as fast as any of us would like. I think that's true with many things in life. And, over the years, I've spoken to a lot of different audiences about my experiences with weight bias. And what I found is there are a lot of good people out there that just don't even see it. For instance, in the media, they don't necessarily see the bias that's out there. And they really want to do well by their friends and their family members. They don't want to contribute to any problems these people haven't, the people they care about in their lives may have. So they're anxious to learn about it. And I'm hoping that this campaign is a proactive approach. Instead of just criticizing what we see as the negatives, we want people to actually learn, get off the sidelines, start speaking out when they can, when they feel comfortable to do that. And I think it's time to make that difference. It's time for this campaign.
Patty, you talked about getting off the sidelines and making a difference, and that's probably the perfect segue to our final question for you. Is what is one thing that someone can do right now to start to help to stop weight bias?
Well, this is the easiest question I've had in a long time. Go to stopweightbias.com, go to the campaign website, and start learning more about weight bias, what it is, how it appears in education, in media, in healthcare, in employment, which is also a big area where weight bias comes up, and start learning about it. And once you've learned about it, and also learn about that obesity is complex. It's not as simple as eat less, move more. Good Lord, if that mantra worked, there wouldn't be anyone who is overweight in this country because everyone has tried. So I think learning more and then stepping up to that. Well, I'm mixing my metaphors here. Are there sidelines in baseball too? I'm not sure. Stepping up to the plate and really examining your own biases first, and then thinking about when you hear things. For instance, did you laugh at that fat joke last night on the sitcom you were watching? Or did you look at somebody walking down the street and immediately, who has obesity, immediately think, well, they're lazy, they don't have any willpower? Start thinking about those things too, and recognizing that maybe you need to rethink your approach and change your thought patterns about it.
Well, Patty, thank you so much. I think your encouragement today to people to either get off the sidelines and step up to the plate, we can use football and baseball analogy there,
There you go.
is very true, especially on such a special day for OAC as today. So thank you very much for your time today, and thank you for being a part of this special event.
Thank you, Patty.
You're welcome, and I'm looking forward to the premiere in just a few minutes. Take care.
Thank you. Kelly, coming off of Patty's last answer about being a part of the solution and getting off of the sidelines, the first thing we want people to do is visit stopweightbias.com. But once they're there, what are some of the things that they can find?
There's so many things that they can find on the website, James. I'm so excited about this part now because one of the things that Patty mentioned is, one of those first steps that you can take to be part of that solution and support the Stopweight Bias campaign is learn more. How can you learn more? Visit stopweightbias.com. So we're very happy on how our website looks and all of the different resources and tools that we put in place in there to help you learn more and how you can become part of that solution. So I'm going to do a quick walkthrough over here of some of the things that you can expect to find on the website. So if you see, you can learn what James mentioned earlier, what is the definition of weight bias, some of the effects of weight bias, some of the settings of where you can find or experience weight bias, as well as stories. This campaign is all about the stories, about real people. So you can read the different stories of people that have experienced weight bias, and we also encourage you to submit your own story so other people can understand how harmful it is and why this is such an important issue to us. Additionally, we have a lot of different resources that we can share. So those fact sheets and the research that we were talking about earlier with Ted and Rebecca, you can find all of the information over here. If you want to report weight bias, you can find that in there. You can find image galleries, the PSAs that we're going to unveil later today, and then any other type of stuff. But let's be real. One of the things that we want you to do when you're on the website is to learn how you can be part of the solution. And there's so many ways in which you can do that, James.
Yeah, and Kelly, you talked about so many great resources on the site, and we'll talk about the solution in a second. But one of my favorite resources on the site is the weight bias quiz.
Yes.
So a lot of times people think that they understand weight bias or they know what the examples are. If you're on the site, take the quiz. You might be surprised at some of the instances of bias that you may not have thought were weight bias, but actually are. So another cool feature of the site as well. We talked about being part of the solution. That's what this is all about at the end of the day. In order for us to stop weight bias, to push this effort forward. And there are a few different ways that you can be a part of the solution. You can join as a champion. So if you represent an organization, a nonprofit organization, and they want to help spread the word, you can become a champion. If you see that you want to sponsor this campaign, if you're with a for-profit company and you'd like to support this campaign, you can be a partner. You can learn more and just sign up for alerts and get more involved with the OAC and our weight bias programming. And then last but not least, you can donate to the OAC. And that's a very important one here, because if you're watching today, we ask that you donate to this important cause. The OAC has set up a specific Stop Weight Bias Fund that any donations that come through the stopweightbias.com website will go directly to our efforts in stopping weight bias.
Yes, I mean, there's so many different ways in which you can be part of that solution. I think like the hardest one or the first step is to actually want to be part of that solution and to learn more. So once you go to the website, you have multiple options in there. Another thing that we're so lucky at the OAC that we have so many people that are willing to share our message and help us spread the word is that an easy way to be part of the solution is help us spread the word to others on your social media or through your emails. Invite others to learn how they can be part of that solution. So thinking about that, we decided to put this really cool toolkit in place, which is a promotional toolkit. So if you go to stopweightbias.com, you go to the footer and then quick links. You go to promotional toolkit. And then as James mentioned, there's partners, there's champions, but we also know that you can do a lot by just checking out this toolkit and spreading the word through social media. If you're an organization and want to share a blog, we created samples for you with graphics. You can send emails, you can access the fact sheets and infographics, and you can even create your own content. So make sure to check out the toolkit, learn how you can spread the word, and invite your friends to do this as well. There's literally a million ways. So please make sure to spread the word and help us stop weight bias.
You know, Kelly, I think you brought up a very, very relevant point in helping to get the word out. These campaigns, they need that viral tone. They need people to be talking about them, to be using the hashtag be part of the solution, hashtag stop weight bias. So go on the website, check out the toolkit. You know, if you feel invigorated today, and we're going to show the PSA in just a moment here, but if you're hearing what we're talking about and you heard Rebecca and Ted and Patty talk and you want to do something, well, this is the time. This is the time to go to stopweightbias.com and be part of that solution. Donate to the campaign, sign up to receive more information. But today is the day. If you want to take a stand with the OAC today, please do so. And, you know, with that, Kelly, I think it's the time to unveil what everyone has been waiting for. Everyone's been waiting around to the almost the end of this special live event for us to unveil the official Stop Weight Bias PSA. There are 5 PSAs. We're going to show you the 60-second one today, and there's 4 more on the website. So, Kelly, with no further ado, let's show the PSA.
I cannot believe that we're here, guys. I'm so excited, and we're so happy. Thank you again for joining us. Please stay tuned. This is the time we've been waiting for. So, action.
We don't want you on our team. You're too slow and fat.
Millions of people are impacted by obesity.
Don't you care what other people think?
You need to do something about your weight.
They face unfair weight bias every day.
You're not the right fit for this job.
Weight bias is harmful, not helpful.
I see you haven't lost weight. You must not be trying hard enough.
Everyone keeps judging me.
I'm eating right. I'm exercising.
I'm trying to lose weight.
But it's just too much.
Our words and actions matter.
Everyone deserves to be treated with dignity and respect.
Learn more about weight bias and how to help end it. Visit stopweightbias.com.
Be a part of the solution.
Let's stop weight bias. Let's work together to stop weight bias today.
Well, there you have it. You're the first ones to see the brand new Stop Weight Bias public service announcement. Will start airing tonight at midnight, nationwide on TV stations nationwide. There are also radio PSAs. There's digital ads. We're doing everything we can to get the word out about this important issue. But let's be honest, we wouldn't be able to do this without the support of all those who've helped bring this campaign to life. So we want to start by thanking our partners, Ethicon, Hitachi, Medtronic, Novo Nordisk, and WW. Thank you so much for your support. Without your support, we simply couldn't do what we do. I'd also like to thank the OAC staff, everyone who's worked so hard on bringing this campaign to life, the OAC National Board of Directors who have given input, the OAC's Weight Bias Committee who's given so much input to this, and most importantly, the OAC members who helped us craft this campaign with those very real, very raw stories of weight bias. Thank you so much for everything that you've done.
I mean, so many people to thank for this. It's a bit of a surreal moment, I think, for us because of all the plans, all the meetings, all the people that we have contacted to help us in the research. And I agree with you, James, we couldn't have done it without all of the people that you mentioned, but we also have our champions, which are these nonprofits that always help us spread the word and support our campaigns and give us their input and their feedback and just help us bring everything out to you and maybe to people that we wouldn't be able to reach otherwise. So we want to thank all of those organizations who are supporting this cause and invite anyone and any other organizations who want to come along and support this campaign to do so. So we want to thank GOPA, OAC, Obesity Medicine Association, the Stop Obesity Alliance, the Obesity Society. And of course, we also want to make sure that you share your thoughts with us about this. You know, we want to know what you think about this PSA and about the other PSAs that you can find on the website, about what happened today, about the stories. We want to hear all about it. So please make sure to email us at social@obesityaction.org and stay connected to us. Follow us on social media, comment, share, spread the word.
Yeah, and you know, as we've been talking about so much in here today, and while it's been a landmark day for the OAC and a long time coming, today is the beginning. This is just the start. Today is the day that we take a stand against weight bias. It's the day that we say enough is enough. And so we want you to join us and be part of the solution to stop weight bias. Please visit stopweightbias.com today. Please share the campaign on your social media channels. And again, we thank all of you for being a part of this very, very special moment in time for the OAC. Thank you.
Yes, thank you so much for joining us on day one of this. We hope to count with your support throughout the entire campaign. So thank you again. We're so honored to have you on this special event for us. So make sure to visit Stop Weight Bias and learn how you can be part of the solution.
Thank you. Goodbye.